Welcome to American Education FM, everybody. I'm Dr. Sean Brooks. Ladies and gentlemen, welcome back. Joining us again is full professor of economics at Marshall University, Dr. Robin McCutcheon. We talk about everything bioweapon related, the political impact, the current economic impact, how all of it ties together, because it certainly does. There's absolutely no avoiding it. And I just continue to find it very interesting that, of course, this continues to be the element in the equation and the variable in the equation that many individuals just refuse to bring up. There are many, of course, who are bringing it up. But if you turn on mainstream radio or mainstream TV, they aren't touching this. Not with a 10-foot pole. They all went along with it. They all participated in it. They all fear-mongered just like everybody. Certainly, at least, everybody within their own line of work in the media. And as a result now, they don't want to own up to it. They just want to blame it on Biden or say, well, it's inflation or this is just the way that it is. And nope, this is the thread that runs through the entire equation here. So go ahead and give this a listen, ladies and gentlemen. Give it a share if you can too, and I will catch you on Friday. Peace.
Big Pharma rolled out these jabs at the beginning of 2021 or at the end of December 2020. And the whole purpose for the jabs that were not deadly, the middling, not quite so bad jabs, was that the effects of those jabs would not be seen for 2 or 3 years. And here we are 3 years on. And so why would anybody who gets turbo cancer today have any kind of a thought process that this was connected to the jabs they got in January 2021? Why would they even think that? They wouldn't. And that was the whole purpose for that kind of a delayed detrimental health effect. But sooner or later, people are going to start waking up and making the connection. And I know so many times that I read articles where doctors are baffled. Well, how long are people going to put up with doctors are baffled before they start looking for their own answers and making their own connecting the dots pathway so that they can see what happened?
Yeah,
even...
Go ahead.
Go ahead. Oh, no, go ahead.
I was just going to say a phrase I heard just today is that doctors are scrambling.
Scrambling. Well, they're probably scrambling to save their butts.
It very well could be.
But even in my own family, I have a sister-in-law who's a registered nurse, and she was the one that pushed it through my in-law family. Everyone got jabbed. Everyone, twice, 3 times, 4 times. And for my mother-in-law, she got the first jab in January 2021. I couldn't give you a date, but it was middling of January. And then she went back 6 weeks later at the end of February to get a second jab, Pfizer, both of them. And by the end of March 2021, she had advanced cancer, I think, in her breast cancer. And so the doctors put her on chemo and radiation, and that just made her completely sick. Now, I know that chemo and radiation does, but she was so ill they thought she was going to die in April 2021. So they stopped all of that and did something else, and she came out of it. But nobody connected that advanced turbo cancer with the jab that she had just had. She never had breast cancer, never had cancer before that, and still nobody makes that connection. But she continued to get boosters.
Oh, wow.
And we went to visit them. We went to visit the family and for Thanksgiving, because my husband said, I have a feeling that by Christmas it will be too late. Well, it turns out Christmas Day they were hauling her into the hospital because she was so sick that she couldn't breathe. And it turned out that the cancer had come back and invaded the sac that surrounds the lung. I think it's called I'm going to get this name wrong. Pleuresis? I don't know. Anyway, it's the sac that surrounds the lung, and that sac was filled with water. They took quarts of water out, several drainings, and that was what they found at Christmas. And they still not connecting any of this with the jab. And she had some kind of a heart ailment where just before Christmas she'd been into the hospital where they said, well, the bottom two ventricles of your heart aren't functioning properly, but we really don't know why that is. So it was a ventricular tachycardia. Still not connecting any of that with the jab. And I was looking up in the Pfizer summary document that they issued they finally got it out in 2022.
Yep.
For their summary of the test, the first 90 days that they did in 2021. And these things were listed in the last 9 pages of health side effects. And still nobody's connecting it to the jab. But the doctors told her, unless you undergo chemo, there's really nothing we can do. And she was so ill. She felt so poorly that she didn't even think she'd be able to make it through chemo. And the doctors confirmed that her entire immune system was so compromised, they didn't think she could make it through either. So, so we buried her last week.
How old was she?
I think she was about 83.
Okay.
So, they're saying, well, she's old.
See that right there?
Well,
yep, that's it.
Yeah, hell's bells. My dad was still climbing trees at 83. Don't give me 83 as old.
Yeah. That right there is another aspect of this rationalization that is very pervasive. And it's that individuals are looking at these people and they're saying, well, they're old, or well, they're overweight, or well, they never took care of themselves. Yes, they were young, but they didn't take care of themselves. And these are all of the, again, excuses that are being used. And I'm saying to myself again, wait a minute, look around you. What's the one thing they all have in common?
Right.
And they're not even thinking about that.
Yeah. So, interestingly, we were at the funeral, and of course, all the older generation is coming in, all of her generation, and just eavesdropping on conversation between my husband and I. Every single person of her generation were saying, we've been to so many funerals this year, just in the last year, since April a year ago. So, and nobody's making the connection.
Yeah.
So the other death that we had in our family was my son's girlfriend, who they've been together for years, almost a decade. She was as close to a daughter-in-law as you could get, without the actual papers. And she threw a massive blood clot in the middle of February. She had a stroke, and it fried her brain. And, of course, doctors can't do anything. Her family was so distraught that the doctors finally had to do an MRI or a CAT scan or something to prove to them that her brain was not functioning. She was clinically dead. And so she passed away 2 days before my mother-in-law. Well, less than 48 hours. So March the 3rd and March the 5th.
I'm sorry.
Yeah, she was 43. So, not old.
Right.
Massive blood clot, gone.
And what's the explanation or the conversation around her?
About why she threw the blood clot?
Correct.
I don't think the doctors did any kind of exploratory anything on her. She had been complaining for a while that she couldn't feel her feet, and then this numbness kind of worked its way up her legs. And according to my sister-in-law, who's the RN, she said, "Oh my God, that's classic blood clot." Well, if you're not a doctor, I guess. And I honestly, Sean, I have no idea why she didn't have doctors check this out. And maybe she did, and maybe they didn't know. But it seems to me that the doctors that we have these days are particularly clueless. I mean, they should give back their medical degrees. They're useless. The doctors themselves are useless, and the medical degrees are useless. And so she's not old. They can't say, "Oh, she's old," because she's not.
Yeah.
And she'd been in the hospital a few times during the rollout of the jabs. And if you signed the electronic medical forms, in there was permission given that they could give you any vaccination. So I'm sure while they were, working on whatever they had to work on, I'm sure they gave her the jab because it's extra money for them.
What was her profession?
She was a waitress.
Okay.
Yeah.
So feeling the pressure probably from coworkers?
Could be. I don't know. When I asked her last year if she'd, just a casual conversation, if she'd gotten any of the COVID jabs, she said, "Oh no, of course not." But again, if she had been in the hospital. She'd gone in for reconstructive surgery on her nose because she smashed her nose up real bad in a car accident. And so when you go in and they put you under, they can give you anything if you have signed the electronic papers. And I think she was jabbed because I'm fairly certain she was, because even though I know my son was not jabbed, he was having symptoms of spike protein
shedding.
I want to call it, yeah.
Right.
So I sent him some NAC, and I said, "Take this; it will help." He never, of course, tested positive for COVID because it doesn't exist. But even their stupid little test didn't come out. So I know that at one point whenever Paxlovid came out, I know that one time they had diagnosed him with the flu, and they gave him that, and I think he took a couple of doses and found himself feeling mentally, how can I say this? Feeling like he wanted to commit suicide. And he said, "This isn't right." He finally kind of shook himself out of this fog, and he started doing some research on this Paxlovid stuff, and he just threw it away. He never took it again. Tossed it in the garbage.
Yeah, it's the same company that makes Chantix. And all of those, I believe Chantix is an antidepressant or a sleeping pill, if I'm not mistaken. And again, same kinds of side effects. An individual goes from being completely level-headed to having a total chemical imbalance that immediately leads to the thoughts of wanting to kill themselves.
Yeah. Well, he had enough of his wits about him that he realized that the only thing that had changed was he took 2 doses of this drug. And he made the connection fairly quickly, threw the drug out. Within a day, he's feeling 100% better, back to his normal self. And when he told me this, I just about, my heart fell into my shoe, and I said, "My God, get rid of that." He goes, "Don't worry, Mom, it's already done. I already threw it out." And I said, "Well, stop trusting the goddamn doctors." Sorry.
That's fine. Yeah,
you
absolutely.
Bleep me out. Stop trusting those bastards. They don't know what they're talking about. He said, "Clearly."
I'll tell you what, too, that makes me wonder, and again, I'm not saying this to pry, I'm only asking because I find I find the familial dynamics of this entire thing, of course, beyond interesting. Of course, everything that's taken place over the last 4 years, I have found fascinating from a
Mhm.
relationship standpoint. But you've said in the past too on the show here that your daughter took the shots. So
Mhm.
when these kinds of individuals or illnesses and individuals, somewhat close to her even start to
Yeah.
have ill effects and then pass away, have you heard from her? What's her take on this?
She doesn't. She hasn't made the connection. So both she and her husband had 2 doses. I don't know if they've had boosters, but within, let's see, March 2021 to July 2021 is what, 4 months? Within 4 months of the second dose, her husband had um, massive cataracts, like old man cataracts, like cataracts that people in their 80s get. It was so befuddling to the doctor. He said, "You shouldn't have cataracts. You're in your 40s." But he had cataracts,
Wow.
and typically, um, because they've had these shots, and I'm fairly certain, I'm positive that their immune systems are compromised because any sniffle that my grandson brings home, it turns into a massive upper respiratory condition for my daughter. She hasn't made the connection, and she won't listen. You know, when these shots first came out, I called her and I said, "These shots are coming out." I said, "Don't take it." But she said, "Oh well, I already did." I said, "Please don't take any more." And she said, "Don't tell me what to do." Okay, I
Yeah.
won't.
Yeah. It's
And then when they the FDA approved it for children under 12, I said, please don't give this to the grandson. And she goes, "He's already had one." Okay. I don't know what else to do. I would like to remain on a speaking relationship with my family. So, she told me, "Back off, shut up, sit down. I don't know what I'm talking about. You know, you're just a conspiracy theorist." So, that it's at that point, the only thing you can do is put the whole thing in God's hands. And that's where I've been living for 3 years.
well, since we're talking about the shots, let's keep going on staff members. I mean, what are you seeing among staff members? Are they taking more time off? Are
Oh
they
yeah,
reporting being ill? Do they look ill? Or what are students
yeah,
saying?
yes, yes, yes. One of the people boasting in the fall of 2021 at a faculty meeting that she just had her booster, and then she finds herself last fall. She's just constantly sick, and she made a comment to me. We're walking into the building together, and she's kind of hacking and coughing. I finally got her to stop wearing a mask. I said, "That mask is not helping you. You've got it's." She goes, "Oh, but I've got a virus." And I said, "That virus particle is so small. It's flitting in and out of the weave of the mask. The mask is not helping you, but it is catching all that crap that you're breathing out and then breathing back in to help make you more sick." She goes, "It does that?" And I said, "Yes, please go look it up." She did. She took the mask off, but by the time fall 2023 rolled around, and she's still ill. And like I said, um, she was complaining to me, and I said, "Well, surely you've. What does the doctor say?" And she said, "He said that my immune system is supercharged."
Oh
And I
god.
went, "Huh." I
Yeah.
said, "Well, if your immune system is supercharged, doesn't that mean that it works better?" And she goes, "Well, one would think." And I said, "So if it's working better, why are you sick all the time?" She goes, "I don't know." And I said, that doesn't sound like a supercharged immune system to me. That sounds like your immune system is crippled." And she goes, "Huh." So roll forward to January. and she's still sick. She gets these upper respiratory conditions that turn pretty desperate pretty fast. And I met her in the hallway one day, and I said, "You're sick again?" She goes, "Yes." And I said, I'm pretty sure that what's causing this is not a supercharged immune system. I'm pretty sure that your immune system is depleted. And there's evidence out now, and I can send you the paper, that it was the Pfizer jabs that caused this. And you got 3 of them, didn't you? She goes, "Yeah." And I said, "Yeah, it kills your immune system. Here, I'll send you the paper." So I did. And she's a fairly dark complected person anyway, and her face just went white as a sheet. She said she called me back into her office. She goes, "Oh my God, what am I going to do?" And I said, "Well, I'd start taking some N-acetyl L-cysteine." She goes, "Well, where do I get that?" So I sent her a website, and she's been much improved. I said, "I wouldn't take any more of these jabs if I were you. I wouldn't take any jabs, none, because all of the vaccines now have this mRNA crap in it. I wouldn't give it to your little girl either." And I said, "But you know what? I'm not a doctor, but I have done a lot of research." So I finally broke through on that barrier. Small miracles. There are more people, more professors who are in and out, sick. We've had several retirements where these people aren't that old, not really, but they're not feeling well, and so they're just gonna go home and be with their families. Um, the secretary of the department that I'm in is taking even more time off than normal. And she already admitted to me that her immune system was compromised um, before she got jabbed. And her office is located such that when I was talking with this other professor about a compromised immune system and that it was caused by the Pfizer jab, I turned around and looked at her, and she just looked as pale as a ghost. So, the information is leaking out. And once again, I've had this semester, the spring semester, we're not even done with it, but the fall semester, I stopped counting how many students had family members who died. I just stopped. After 6, I just stopped counting. Because, but I have not hesitated to let the students know my opinion about how the jabs compromise the immune system. I've not stopped speaking. Although, by the time we got to fall 2021 and we got back to face, a number of these students have had 2 or 3. But the good news is we're coming into a period of time where the students that I now have, my youngest students were in 10th grade when all of this happened, and many, many, many of their families did not get jabbed. I'm finding more students whose families said, "No, we're not doing that."
Good.
Maybe the students and their parents, but it sounds to me like the older generation just plunged in.
Yeah, it definitely took a bunch of people by surprise, and of course, as soon as the rollout occurred in 2021, it wouldn't have been available for the younger individuals, of course. But then again, it was I guess that would have been August of 2021. So when they dropped the age from, whatever it was, 20 and above to 18 and below.
Right. It wasn't until I think early 2022, and I don't quote me on a date, but it was early 2022 when they dropped it from 12 to 5.
Correct. Yeah.
I don't remember the date. I just remember calling my daughter and saying, "Please, please don't do this. He doesn't need it." "Well, we're going to do what the doctor says." I just went, "Oh my God, okay. All right. Mom doesn't know anything." she's an idiot. Obviously, she's only got a PhD, so, and it's not in medicine. So, you know,
Yeah. This is the brainwashing. This is how thick it is. It's so thick. It's always had these, family members believing that they know more than others, even if they live in the same home.
yep.
It's one of the odd phenomenons of this entire thing is that it's ruined marriages. You'll have individuals who've been married for 30 plus years and they're living in the same home. And then one of them says, "Well, I'm going to go get the shots." And the other one says, "Don't do it. They're going to kill people." And then they say, "Well, mind your own business." And I mean, it
Right.
blows me away.
Yeah. 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 It's sad. But like I said, I want to be able to still speak with my children, and um, and we made an effort. Both my husband and I made an effort in the fall of 2021 to plead with our family members to not take the boosters. We caused a huge row in both sides of our families. I mean, I can't tell you how big the blowback was. It was huge, and nobody listened. Everyone got jabbed another time, and color me shocked when stories from my side of the family are drifting back to me that so and so is ill and this other so and so has this or that thing wrong with them, and it's all of a sudden, and I refuse to say I told you so, because I'd still like to talk with them, and they're just ornery enough that they would say, "Well, screw you, go take a hike. I don't need to talk with you anymore." So I'm not playing the "I told you so" game, but I'll tell you, I've never done so much praying in my life since these last 3 years. But at some point, the penny will drop. They'll get a clue or two, and then we'll see what happens. But there isn't anyone in either side of our families, either on my husband's side or my side, that doesn't know that we've never been jabbed. We told them we were never going to get it. We told them it was poison. All of them. All of the jabs, we've told all of our family members, we're not getting jabbed. It's poison. Don't do it. As recently as the fourth jab, so second booster, one of my husband's sisters emailed us and said, "Please get the booster." He emailed her back and said, "No, I'm not doing it. It's poison. I'm telling you, I'm not doing it." So she said, "Well, don't bother to come up and visit because you'll make mom and dad sick." So he said, "Okay." So we stayed away. We stayed away so long that finally she emailed us and said, "Well, how come you're not coming to visit?" He emailed her back and said, "You told us not to." "Oh, well, mom really wants to see you." "Yeah, well,
Yeah,
not coming along.
I thought our
Yeah,
I thought our presence was going to kill her.
Yeah, thought that was going to happen. Nope. And now it's okay. All right. Yeah, we didn't see them from 2019 to last Thanksgiving for 4 years. And my husband, I looked at him sometime in September. And all this happened in September ish, when the sister said, "Mom really wants to see you," and we had a conversation with her on the phone. And my husband says, "You said not to come. We're not jabbed. We're not coming." And she said, "Well, mom really wants to see you." And he says, "Well, then I don't want to hear any. I don't want to hear any lip. I don't want to hear it." And so the penny still has not dropped with her when from Thanksgiving to Christmas she has ventricular tachycardia, and then she's got this bloom, this absolute cancer bloom in her body, and less than 2 months later she's gone. Didn't even occur to her that it was caused by the jab.
And of course, other than you and your husband, I mean, there was no one around her to tell her otherwise.
Right. Well, she was in the email trail when we sent it out. I mean, because we emailed everybody. We We emailed the sisters, the brothers, the mom, everyone. Everyone got an email in the fall of 2021 saying, please don't take the boosters. Tim even talked with his mom. My husband even talked with his mom January of 2021 saying, please don't get this jab. Oh, well, I already got mine. I'm going to go back the end of February and get the second one. Please don't do that. No, it's okay. Your sister, the RN, says that, I've got to have the complete set. Like I've said many times, I've got skin in this game, just like everyone else. There isn't going to be a family in America that is not affected by this some way, somehow.
Given the landscape of Marshall, and again, the last time that we talked, I remember you mentioning, the number of students or the lack of students that were walking around, and then you said something about how it was pretty inevitable that they were moving toward an online environment, in particular within your new building. Is that pretty much full steam ahead?
Oh yeah. They're going full blast with that. This new building that we're in is clearly designed to be a conference center of sorts. I think it's like the first salvo of putting in a conference center on Marshall's campus, and Marshall has been doing everything it can to buy up properties between the center of campus, westward, as close to downtown Huntington as it can possibly get. So the new building that we're in is only the first of many. There will be other buildings that go up across the street and next to the, I gotta get my directions right, to the east of us, to the east of our building, between us and campus. All of the blocks, 2 blocks between us and the rest of campus will be bought up, and they're going to put in a huge conference center, like you would see at like the Atlanta Marriott Conference Center type of thing, where they have a hotel and they've got shops and everything.
Wow.
So Marshall is definitely moving into the direction of becoming a landlord. They've made connections, of course, with the hospital system that's in our area. St. Mary's and Cabell Huntington, I think, have already merged. They're now one system, even though it's 2 separate hospitals. But they did that shortly after the CARES Act started rolling out money to the hospitals to take care of COVID patients, and I'm going to put it that way. They just didn't. They can't make enough money to stay alive. And so they thought by merging and becoming one gigantic hospital monopoly that they can access enough money through Medicare and Medicaid, and any kind of state and federal handouts that they'll be able to survive. And I don't think so. Medicare and Medicaid just don't pay enough. It's a poor business model. When the amount of money that a hospital receives for any kind of healthcare treatment doesn't cover the treatment, then it doesn't matter how many patients you have, you're losing money on every single patient. And that's basically what's killing our healthcare industry. Except for physicians who drop out of that particular industry and do their own direct primary care office. Those physicians are actually doing pretty good. But the rest of the healthcare industry, it's going belly up. It's just a matter of time at this point. So what Marshall has done is they've made connections with this hospital system in an effort to keep their own entity alive, because they're looking for handouts from everyone. State, federal, donors, doesn't matter. I think the whole thing is going to go belly up, Sean. I don't know how fast it's going to go belly up, but these places cannot remain alive if the amount of money they're spending to have a product. If their production cost is exceeding their revenue, they can't make it. It's financially impossible, and that's what's happening. That's what I see going on. And so the push for online, of course, is that they're hoping to extend the Marshall brand worldwide. I mean, they've already extended the borders of in-state tuition to a 100-mile radius around outside of West Virginia to Kentucky and Ohio. And I think they've extended some of it up into Pennsylvania as well. But they don't have enough students. Inside of West Virginia, the last time I checked, there were 26 institutions of higher learning. So 2 major universities and 24 other smaller colleges and technical colleges. And so Marshall has been trying to suck up some of these other technical colleges and sweep them under the Marshall umbrella so they can save themselves. But they can't, because their total cost of doing business is higher than their total revenue. So they're not making any money.
No. They have to be hundreds of millions of dollars in debt, just like Miami University is.
Well,
or tens of millions.
Funny you should say that. In the fall, a little blurb went out across the media, the local media here, that West Virginia University was something like $47 million in debt because the president of the university for the prior 2 years had, can I say, fudged the numbers? He was using a model of student headcount that was twice what the actual student headcount was. He lied.
Sure. Yeah.
And so West Virginia University is $47 million in debt, and Marshall University somehow comes up with $47 million. I don't know where it came from.
Interesting.
I'm not saying someone from WVU pilfered the bank account and sent millions of dollars Marshall's way, but Marshall got money that I think might have been earmarked for WVU from the state government. Just a guess.
Sure.
I don't know for sure, but seems awfully funny that money didn't make its way to WVU. It made its way to Marshall, and that told me that there was a shift at the State House for most favored university status.
I also recall this, now that you just mentioned that. I remember, and I think we brought it up together in a conversation between the two of us. I certainly brought it up on my show, but it may have been either, again, Miami University or other universities across the nation, if not Marshall themselves, which, again, it's possible you brought it up too, was that they were changing the parameters of what constitutes the actual definition of a college student, of an enrolled college student. So they were saying things like, if you are a single major, then you're counted as one student. But if you also have a minor major, then you're basically like 1.5 or 2 students. And if you're double majoring, then you're basically counted as almost 4 students. It was something preposterous like that. And I thought to myself, well, of course you'd have to do that. Of course you would have to change the rules of the game because no one's showing up to your universities anymore.
Right. Well, I don't think Marshall was doing it on majors, but I know the way they have been doing it is if you're a face-to-face student, you're counted. And then if that same student is taking online classes, you're counted again.
That's it. Right.
Yep. Yeah. So they're double and triple counting students.
Yes.
I don't remember what the third twist of that wire was, but one student could be counted 3 times. And I was thinking, wow, that just sounds really dishonest. It's like
Yeah.
it's like taking a special mix of vitamins that's supposed to help you lose weight, and then while you're taking that, you continue to eat the chips and drink the beer.
That's right.
and
Yep.
then and then you're disappointed that the scales are showing that you're gaining weight.
Yeah. It's fraud.
Hmm.
It's amazing. Let me do
Yeah.
this too, because we're talking about the jabs, of course, and the economic impact, and the health impact, and the social impact. I came across this list last week, I believe, and I wanted to read this to you. And I don't know if you've seen this or read this yet, but this is an individual on X, and they run down a list of all of these companies and the number of stores that are closing. Have you seen this list?
I have not,
It, it
but I know that there are a number of. I know that that's what's going on out there, even though I've not seen the list.
Yeah,
But yeah,
it's remarkable. Let me rock through this real quick. It starts off with
sure.
Walmart. It says Walmart is closing 23 stores in 8 states, all blue. It says
Huh.
Target is closing 9 in 4 states, all blue. Walgreens is closing 900 stores, mostly blue. 900. It says
Wow.
Bed Bath & Beyond is closing its remaining 360 stores. Lowe's has closed 50 stores. Macy's is closing 150 stores, mainly blue. Starbucks has closed 61 stores, mainly blue. Home Depot's closing 15. Dollar Tree is closing 1,000. Foot Locker is closing 400. Gap is closing 350. It keeps going.
Oh
It
my
says
goodness.
Party City is closing 24 stores, mainly blue. Big Lots is closing stores in California and Colorado. Burger King is closing 400 stores. Best Buy is closing 20 stores. Boston Market is closing 27. Kmart has only 2 stores left. Sears,
Yeah.
yeah, in fact, I think they only exist in Australia now, if I'm not mistaken. Sears closed all but 22 stores. Regal Cinemas has closed 429 movie theaters. Kroger,
Wow.
Kroger grocery chain has closed 413 stores. US Bank is closing 23 branches. Wells Fargo is closing over 60 branches, it says. And then it says Capital One is closing 50 branches. Bank of America is closing 20 branches, all because the economy is so wonderful, unquote.
Yeah. Well, in my own area, the Kroger stores in the tri-state region were told by the union that the union was going to strike because they were demanding cost of living raises, and Kroger can't afford that. They kind of pushed back and said, well, and I'm the numbers that the students told me, I think were like, we can give you a 4% increase. Well, 4% increase is not going to cover the 15% inflation rate. And so the union said, well, we can't do that. We need more money. And I looked at my students and I said, so I guess Kroger's is going to close, or they're just going to get rid of their union. They're just going to say, no, we're not, go on, head on out the door.
They
But
forced,
apparently
they forced the shots on their employees.
Yep.
Their employees are getting sick and getting dead, and as they are still sick and still alive, their cost of living is going through the roof because of all of the medical bills.
Right. Yes. Yep.
These people have wiped out their own lines of work. They've crushed their own businesses, and they have no idea what caused it.
And they're still not connecting the dots.
No.
Yep.
I'm telling you, this whole bioweapon element has got to exist in almost every book going forward in the future as sort of being the variable in the equation that causes this collapse.
Well, Edward Dowd has been screaming this from the rooftops since the fall of 2021.
Yeah.
When the death rate started skyrocketing, and his new business, Finance Technologies, spelled with a PH instead of an F for finance. They've been analyzing data from both Britain and the United States. And Dowd has said, even 6 months ago, he said in the labor force, we're looking at somewhere around 35 million people who are disabled permanently. So if we're talking about the labor force, we're talking about 1/4 or more of people over the age of 16 and under the age of 64 that aren't going to be working or working very little because they've been jabbed and they've been physically harmed. And so, his group does some really good data analysis. And he says, look, I'm not a medical doctor. I'm just counting the numbers. And the only thing that changed, so if we're looking at mortality tables, which actuaries use in order to estimate how much money a company needs to set aside for retirement for any particular individual, those mortality tables have been steady numbers for 150 years. And the only thing that has changed is the jab. And that was the thing that Edward Dowd has been talking about since fall of 2021. He said the only thing that has changed has caused all these excess deaths and all these excess injuries is the jab. It wasn't COVID. COVID had nothing to do with this.
Yeah.
It was the bioweapon. And, even my own comment among groups that I'm associated with, when I've said, look, what's going to happen out in the medical industry is that the insurance companies are going to collapse. I had people laugh at me, but one of the groups that I'm associated with, the organizer of the group, actually took that little tidbit of information to one of the conferences he went to about a year ago, because he laughed at me too, and he said that's crazy. But he took that little tidbit of information to a conference where he had the 5 big insurance representatives from the 5 big insurance companies sitting at a panel discussion, and he said, I've got an economist who says that health insurance companies are going to go broke and go out of business. And there was this long silence. And then one of the panel discussants spoke up and said, well, we're actually moving into a data analysis business model, not health insurance. And
wow.
He brought that back to me, and I guess that just made him go, holy crap, McCutcheon's right again.
Yeah. I remember you mentioning that and thinking to myself, yep, it hit him like a freight train right then and there.
Yep. Yeah, and this poor guy is still trying to make a model of the standard business model between a health insurance company and an employer, where this guy's company is the middleman trying to do something for the employee. And I keep shaking my head at him going, that model doesn't work, and it's never worked, and you're going to die on this hill, because the only model that's going to work for health care going forward is direct primary care, where it's the physician and their patient directly face to face, and there's nobody in between, not a health insurance company, not an employer, not anyone else, and your business model is going to fail. It's never actually worked, but now it's just going to fall over. And he doesn't want to hear it. He's not been jabbed, so, his brain is still functioning, but he doesn't want to hear that the business model that he's hanging his hat on is going to fail too.
Right. Yeah. They can pretend like it's not going to make the impact that it's already making and has been made.
Yeah, exactly.
Yeah. You can only pretend so long. Let me, I'll tell you what, let me read you this. This connects directly to it. This is a text that I received from a business owner friend in Michigan, and they send me a great deal of personal stories because, again, the walls are closing in among the people that they know too. And this person is wide awake. And they send me a great deal of information regarding insurance numbers and real estate, which is what I want to mention next. But first, they sent me this just the other day. They said, my best friend from childhood, who is our age, had to get the jab for work because he has to internationally travel. He developed a clot so severe that he was rushed to the ER, put on life support. He technically died twice that night. Doctors told his parents that it's unlikely he will survive, but he did. They then said he's now completely paralyzed on the right side of his body and he has very little ability to move the lower half of his body. He's now been in physical therapy for at least 11 months, learning to walk again. He has three young kids who no longer have a dad. His insurance ran out. His wife refinanced their home to pay for physical therapy. He went from making $150,000 a year, living in a beautiful home, loving dad who adored his kids, to basically bedridden, needs his wife to wipe his ass, can't pick up his children, can't work, and doctors are baffled. And then they said at my son's graduation party last August, his parents were telling me that doctors are shocked because, quote, there is no history of clots in the family, and he's only 42 years old.
Mm-hmm. Yep.
And that leads me, of course, to this, which has to do not only with school, but just, of course, insurance rates across the board. And we've discussed this already, and you're well aware that the percentage among everyone is going up. And one of the excuses they're consistently saying is, well, that's just the way that the market is now. And then school boards in particular, they just, they all agree and go, yep, hard times, inflation, that's the way that it goes sometimes, but it'll come down eventually. And they have no idea that it's never going to come down.
Right.
It's just going to keep going through the roof. And again, it's over 13.2% increase in almost every single school district, if not higher.
Yes. Well, when the shots rolled out, I made a prediction. I was sort of casually talking with some of my younger colleagues, and the shots rolled out, and I said, well, I'm going to make a prediction right now that by 2022, your healthcare insurance costs are going to double or triple. They looked at me and said, why would they do that? And I said, well, because these shots are bad, and it's going to make people sick, and the more people are sick, the more health care they're going to require, and then somebody's going to notice that they need to raise the rates. That'll never happen. Sure enough, summer of 2022, the two insurance companies that cover state employees for West Virginia raised their rates, but not by double or triple, by quadruple. I missed it by 100%.
Yeah.
On the downside.
Yep.
And they were shocked, and I just stood there and nodded and went, yeah, told you guys, rates are going up. Well, why? Because these shots are bad. They make people sick. The more people are sick, the more it costs them at their doctor or at the hospital or whatever, and rates have to go up to cover the larger pool of now sick people. And this is the thing that a lot of people don't understand about health insurance. The reason that the health insurance model has worked, I'll put that in quotes, it's a scam, right?
Mm-hmm.
The health insurance company wants a very large pool of people, 95% of which are pretty healthy. The health insurance company is not going to spend very much money on these 95% of people are healthy. And typically, a health insurance company really only wants 5% or less of the pool of people to be sick or desperately sick. Because when that amount of people, that percentage of people goes from 5% to 20%, now the pool of people is mostly not healthy. The health insurance company has to raise the rates because it's the healthy people that are subsidizing the unhealthy people in that model. And this is what I told the director of this group that I'm involved with, Insurance Risk, and I told him this is the model of health insurance companies, and this is why your business model is going to fail, because you are connecting businesses with health insurance companies who are going to continually raise the rates, and they're going to skimp as much as they possibly can. They're going to say no to every kind of health care just so that they make some money. Because the pool of people that are healthy is now much smaller than it was 3 or 4 years ago. And so I said it's unsustainable. It really is. Your business model is crap. You need to change it. I don't know what you need to change it to, but you're going to go out of business too if you hang your hat on this.
Yeah, they've burnt the candle at both ends,
and then in the middle.
That's right. Yeah,
and then they're wondering why they have no candle left.
That's right. Yeah, that's it. And they don't seem to understand that every business, regardless of the business, requires participation. If you kill off your customers, and the participation and them using your product are the only thing keeping your business alive, well, you're finished.
Yes, and I think that was one reason why the Marshall University cobbled together with the 2 hospitals that had merged to create a Marshall health system so that they could get some kind of break on prices for all of these people inside of Marshall that are ill.
Yeah.
Now think about it, because that's, what else are they going to do? Look at all the employees and say, gosh, we're really sorry. We really suggested and coerced and forced and extorted and bribed you to get these jabs, but you know what? We just can't afford your health care now. Nobody's ever going to say that.
No, and it isn't going to help them either. It's not going to matter if there's a wellness center right in the middle of Marshall's campus or Miami University's campus or any campus. Again, Miami put up a giant multi-million-dollar health facility right in the center of campus.
Oh my God.
And they think, for both educating, quote unquote, the future nurses of America, and then at the exact same time, they have no idea that even if they're doing that in an effort to keep money on campus, well, when you still kill your employees and your student population who are your customers, it's not going to matter.
Right. Yep. I know.
As a side note too, I saw this the other day. I was going to bring it up on my show, but I didn't because it didn't tie into anything. There was an article in the newspaper, in the Tri-County newspaper here recently, and it's basically a steel factory right here in Butler County, and I believe it's a steel factory. Anyway, they were hiring and are hiring summer help, and they're specifically looking for juniors and seniors in high school. And they're basically saying, again, do you want a summer job? If you're a junior and senior in high school, here's what we would like you to do. And what they want them to do is, of course, they basically just want them to do landscaping on the outside of this factory, this multi-acre, facility. They want them to cut grass and, put mulch around and weed whack and do all of that stuff. And then they promise them that, as they're an employee, they're making $20 an hour all summer long, that, they'll let them inside the factory and give them a tour and basically try to recruit them to be factory workers when the summer is over, if not, years down the line once they graduate from high school. And then you get to the bottom paragraph, the last paragraph of the email or of the article in the newspaper, and it says, all applicants have to have received the COVID vaccine. Again, I had my jaw hit the floor, and I thought, you know what? I'm going to email these assholes. And so I emailed them, and I think I titled the subject line something like, summer job application. And then I just told them, I said, so I was interested in learning more about your summer job application for cutting grass and this, that, and the other. I said, I find it interesting that you're only asking for juniors and seniors in high school. And I saw that at the end of the article, unfortunately, you're asking everyone to be COVID vaccinated, which I put in quotations. And I said, you're either on drugs or you're vaccinated yourself. And then I ran down this huge list of all of the things that they don't know. And I said, you would do well if you want to maintain your business to never require these shots ever again for anybody who applies for any position at your company. whether it be a summer job or any other job. And sure enough, on their website, they have endless jobs available for actually
I'm sure
working.
they do.
Yeah, I mean, it's at least 100 plus. And I'm saying to myself, do you find, I said this, I said, don't you find that interesting? That you force the jabs on all of your employees, and yet you have all these open positions and you can't figure out why. And like I said,
Yeah.
I went through this huge list. I was like, don't you find it interesting that your health insurance rates are going up? Don't you find it interesting that all of these people that work in your factory are sick all of the time? Don't you find
Or
it interesting?
dead.
Yeah, exactly. That's what I said. I said sick or dead. I said, and what about your own personal lives? Do you know people in your own personal lives who are sick and dead from the shot rollout? As soon as the shot rollout took place, I said, good luck in your application and good luck in finding employees. And that was the end of the email. Of course, I haven't heard back, but
Right.
I mean, these people are dead asleep.
Well, don't feel too bad about them because the entire actuarial industry is just as clueless. And these are people who work with data all the time. These are the people who work with companies, white collar workers, blue collar workers, those people, the workers. And they're mystified and perplexed why the excess death rates just skyrocketed in the third quarter of 2021. And so here we are, 6 quarters later, and they're still mystified. They're just clueless. They just don't understand why their mortality tables have been blown out of the water. So it's not just it. You're right. These people are just sacked out of sleep. They're so totally brainwashed and propagandized that they can't see. They can't see the raw data. They don't even understand the raw data when you show it to them. But look, Yuri Bezmenov, way back in 1984, the former Russian KGB agent who sat down with G. Edward Griffin to tell everyone this is how the communists take over your country. First we employ a demoralization process where we not only do we infiltrate your schools and your government, but from the school standpoint, where what we do is we remove the moral values of your culture. Demoralization doesn't mean that they make people feel bad. It means that they remove the moral values so that people don't have that North Star that guides them. They they deliberately put into operation plans that will destroy the family. I mean, that was one of the reasons the Great Society, that LBJ signed the Great Society Act, the Welfare Act, because it was going to remove black fathers from black families, destroy their family, and make the mothers dependent on the government. Yuri Bezmenov was telling all of us this 40 years ago. And he said in 1984, he says, Yuri Andropov could not have imagined just how well all of this is working in the United States in 1960. He says, you guys are well on your way to being conquered by the communists. And that was 40 years ago. So why are we surprised here 4 decades later when school children are dumbed down to the point where they don't think? They're taught not to think. So why on earth should I expect my students in my classes to start thinking when they've been taught their entire lives not to think? And I recently, I received an email, gosh, I can't remember from who, but I think it was somebody in the IT department high up, where they were talking about how Marshall University is considered a K-16 school. Let that one wash over you. A K-16 school. And they're continuing to promote good pedagogy. Now, you were the one who told me some years back, you shouldn't be using pedagogy. That's for children. You should be using andragogy. That's for adults. That's how adults learn. Adults learn differently than children learn. I pointed this out to my junior, senior class the other day, and they just sat there stunned. I said, you're not in university. You're in a K-16 school. I don't know what we're going to call freshmen, sophomores, juniors, and seniors anymore, since that's already taken up by the, you know, 9th through 12th grade in regular school. But no, they don't consider this university anymore.
Yep. 13th, 14th, 15th, and 16th grade.
There you go.
Yeah.
So all of these places have to collapse as far as I'm concerned, and they will eventually. It's not sustainable. As the university professors die off or get so ill they can't teach, think about it. Their entire supply line of professors is damaged as well, because how many universities across the country in 2021 were pushing the jabs, not just on their students in the undergraduate programs, but the grad programs and the PhD program?
Yep.
Where are you going to get professors if you've killed them off?
And one of the other things too that they're doing, and I've made mention of this on my show, is that numerous universities in numerous states, and this is happening all over the place. I mean, it has to. But I've brought up at least half a dozen universities and colleges across the nation that are lowering their standards, so much so to the point where tuition is free.
Oh no, free?
Yeah, free.
Well, who's paying for it?
Well, exactly. What they're doing at one particular university, where I'm going to have this employee on in the coming months here, because they're in the last couple of months of their tenure there. They're just flat out quitting. They said, I can't do it. They're coming after me. They want me to leave, and of course they've wanted to go now for quite some time. But I believe it's well, anyway, I'm not going to say the university yet, but it's a university that, again, is making tuition free for all in-state applicants. But the only catch is that you have to live on campus for something like the first 2 or 3 years. Once you enroll. So I mean, you're paying for room and board, you're paying for on-campus food, you're paying for the books, you're paying for class fees, but your tuition is waived.
Right. Yep. Well, they're going to get socked with great big bills for room and board.
Yeah. And then
somebody's making the money.
Oh yeah. And Northern Kentucky University has done this recently. They've dropped their enrollment parameters so that anybody in state or out of state with the 2.7 GPA is automatically a student there now from high school.
Wow.
As long as you apply, you're in.
Well, I have to tell you an amusing story that I'm sure you will laugh at. A couple of years ago, when was it? I want to say it was around about the fall of 2021. So much crap went down, but I think it was around the fall of 2021. The dean that we had at the time formed a task force for diversity, equity, and inclusion, or to make the student population in the College of Business more diverse. And I heard about this. Two or three of my colleagues from my department were on this task force, and they had sent around a little email, hey, to everybody, hey, can you help us out? And so I went to look at the university admission requirements, and the university admission requirements are basically, if you're breathing, you're in. There's not even no SATs, no ACTs, no grade point average. Just basically, you got a pulse, we'll take you. And so I went back, and then of course I checked, EEOC regulations and such like Title VI and so on and so forth. And I wrote these young professors back, and I said, look, you can't do this. You cannot go out and make for your target audience of people that you want to invite to the university only students of color. You can't do that, because that's discrimination against students who are white. And as soon as you do that, you're breaking all these federal laws. So please don't do this. And the young professor who was basically in charge of this task force wrote me back and said, well, we understand all that, but this is the task that we're given by the dean. And I said, yeah, okay. And he said, well, we want you to come and talk with the rest of the task force and tell them what you just told me. And I said, I wrote it in an email, just distribute it. And that whole thing quietly went away.
Amazing.
And then about 18 months later, the university hired its own DEI officer, and I think he's getting something shy of $300,000 a year.
No joke. Yep. They make a ton of money.
Oh my God, I'm in the wrong business.
No kidding.
I mean, really.
Robin, honest to Christ, if we were dumber, we'd be multimillionaires.
Not dumber, just more corruptible.
That's correct. You're right. Yep.
If we were more
dumber
corruptible,
too, but
okay, well, fine.
Both.
But so then the university wants to put into place DEI initiatives so they can have a more diverse population of faculty, staff, and students. And in our particular college, there's yet another task force working on strategic initiatives, strategic planning for the next 5 years. They have a whole section where they want to uphold the DEI initiatives of Marshall University. So once again, I'm writing an email to this task force and everybody in my department, pointing out in these strategic initiatives where they will be violating federal law. And parts of these initiatives are violating the First Amendment of the Constitution, violating university policy, violating Title 133, Series 9 from the state of West Virginia that protects our academic freedom. And I said, you can't do this. You're going to get sued. I didn't tell them that I would do the suing, which I will if they vote this stupid policy in. But yeah, they just can't seem to help themselves.
I'm glad you mentioned that, because that directly ties into this, which I came across, I believe, last week also, and it has everything to do with that. Bringing in illegal students and even, of course, faculty members, and what that means for the much larger picture, too. It said the following here, and again, you're going to have to forgive me, it was just a screenshot, but it said, quote, international student cheating is pervasive. Chinese influence is rampant, and the university's casualized staff are underpaid and pushed into passing low-performing foreign students. It says domestic students have also been made to carry NESB students through their courses via group assignments. It says local students are paired with international students in these assignments, which frequently results in domestic students completing the majority of the work, essentially becoming unpaid tutors and cross-subsidizing international students' marks. And then it says, just in closing, in essence, the education business has degraded into an immigration racket, with universities acting more like migration agents than academics.
Oh, yeah. Well, let me just add to that. I'll put another little straw on the camel's back. Universities in West Virginia are welcoming transient students. That's how they're listed.
Transient.
Yep.
Wow.
I swear to God, Sean, these universities they've got to be getting federal funds and state funds for all of this. They have to be. The grift must be horrendous. I almost want to say it's almost like a huge money laundering operation. The whole thing.
I wonder if they're tied into the exact same thing that the companies are tied in when it comes to them, the companies going more left and becoming more satanic and more DEI and all of that. I forget the name of it, that particular score.
ESG?
Yeah, there you go, the ESG score. I mean, they have to be tied into that also, because they've been left out of this equation, certainly been left out of the discussion on this particular issue regarding that and that kind of funding.
It could be. I don't know. I haven't done any research into it. It feels weird. It's got a strange taste to it, if I can be unscientific about it.
No, I
but
agree.
you can't have all these students, transient students, and not be paid for them somehow. And I don't know if you've noticed that. Sort of, maybe here's another little straw for that camel's back. When COVID hit, all of our Chinese students were called home. They told me. I had one class that had half the students were Chinese students, and they told me, we're being called home. And I said, okay, are you going to be able to finish the work online? And they all said, well, we should be able to, if we have internet access. And I said, okay, well, we'll cross that bridge when we get to it. But they never came back. None of them.
Yep.
We have had almost no Chinese students on campus since fall of 2021.
Yeah, same with Miami University. It was a massive hub for Chinese students. And then, like you said, as soon as the pandemic hit, it was like they all got on a boat and just left.
Yep.
It's amazing.
Yep. So all of those Chinese students, and at Marshall, they're as a portion of the population, there weren't many of them, but that's outstate tuition. So they were being charged 2 or 3 or whatever the outstate tuition is. It's much higher than in-state, and the Chinese government was paying for all this, and so that's a huge chunk of money that the schools are now not getting. So why wouldn't they substitute transient students for the Chinese students or the Indian students? There was another group of people that went home and didn't come back.
Yep.
Why wouldn't they? I don't know. Every time we turn around, Sean, it seems like what we're seeing is that some government operation that is funding some institution somewhere or company, it's all a big grift. It's all a big money laundering operation. So why not this?
Yeah.
Where is this money coming from? The university you were telling me about that lowered its tuition price to 0, where are they getting some kind of federal subsidy? We know, because you sent me the web link, we know the amount of millions of dollars that the universities got for COVID jabs.
Yep. And that money's gone.
We know that, that money was gone a long time ago. So what have they substituted for it? From where is this money coming? Besides out of yours and my pocket.
Yeah, well, I mean, there's, of course, you have those schools that are eliminating tuition, then you have other schools like Miami University, where of course they're raising tuition among incoming freshmen, and again, people are just laughing at them and saying, "You've got to be kidding me!"
Right? Why would I send my child there? I can send my child down the road for less.
Yeah.
Yeah. No, the whole system is collapsing right around our ears, and I'm just sort of sitting back up in the bleacher stands, watching the whole thing, laughing and cackling. Maybe not like Kamala, and I'm certainly not, clapping my hands like a trained seal. But it's just the most fascinating thing I've ever seen.
Yeah.
Up close and personal.
There was this too. This was tossed to me also by that Michigan business owner, and they sent me this particular story, and then I looked it up, and it's legit. That the realtor business in Michigan is officially dropping its commission among all realtors from 6% to 2%. And they're openly saying, the realtors are saying, we can't live on a 2% realtor rate or commission rate.
Yeah.
I mean, again, it's right up there with it's the exact same thing as any other business, whether it be education, insurance, you name it. If you're selling homes because the people are losing the homes because they're dying, and there's nobody to buy the homes because people either don't want to buy the house or there's people dying who would have bought the home. Then you just have homes that are just sitting vacant. And now, of course, they don't want to they don't want to pay more as an agency to their realtors because they're not moving as much product as what we're being told. Of course, you turn on the TV and everybody's saying, now's the time to buy. And it's like, well, that might be true, but who wants to buy and how many people are buying?
Right. Well, we know that mortgage rates are above 7%. I think they're closing in on 8% now for a standard fixed rate 30-year mortgage. And and every time the rates go up, the demand for homes goes down. Because, anybody who bought a home prior to, let me guess, 2019 was paying somewhere, I don't know, 2.5% to 4%. Why on earth would they sell their home to buy one double the percentage on interest rates? That they wouldn't. That would be foolish. And how many of these homes now that gas prices, at least in my area, are clicking up towards $3.50 a gallon? I know up in Michigan when we were there, the particular area that we were in, it was pushing $3.75 a gallon. And that's going to destroy whatever's left of the auto industry because they can't sell their trucks and their SUVs. People won't buy them. They've already shelved their electric vehicle production. And I know from having worked with people who are in the auto industry that $3.50 a gallon, that's the tipping point for the auto industry. They can predict with some reliability that when gas prices hit $3.50, that the recession/depression is not that far away, within 6 to 8 weeks. So we're looking once again at the beginning of June. And so, how many people are losing their homes because they got an adjustable rate mortgage, and now that really nice low interest rate that they had is now adjusted up twice or 3 or 4 times what it was. And that will increase their monthly payment. So you combine that increase in monthly home mortgage payment with an increase in gas prices, and all of a sudden you got a depression on your hands once again. So how many of these people are just doing jingle mail, like we saw what went on in 2007 and 2008? It's a shit show. Yep. All the way around. I mean, and there's no place to hide this time. The debt bubble that is collapsing around us that most people are unaware of. I mean, I've heard from a number of different people who are knowledgeable in the area of debt refinancing, that the amount of debt that has to be refinanced just for the federal government is something like in the nature of $7 trillion this year. That's what's coming due. And so in order to finance that debt, the U.S. Treasury, the Federal Reserve, has to sell more debt. Well, who's going to buy it? We've got 40 countries in the world that are joining BRICS, and they're leaving the fiat money system, the Federal Reserve type of system, with the EU, European Union. So, I mean, we're talking Brazil, Russia, India, China, plus another 35 nations. They're not going to buy our debt. So this is, man, hang on to your hat because it's going to get real interesting from an economic standpoint.
At least the price of gold has gone through the roof.
Oh, yeah, I saw that today. It's sitting right now, as we're talking, at $2,199.40. But it was up above $2,200 earlier today.
Yep.
So the paper gold sellers are really trying their darndest to get that price under $2,200 and keep it there. But it's not going to last. It's got to go up. Because every time the government spends more money, and didn't they just pass a continuing resolution for 1.2 trillion last weekend? Was
Yep.
that last weekend?
Yeah.
Yeah, so more money printing, and that's only for what, 3 months, 2 months, 10 weeks?
I think so.
So we've gone from continuing resolutions that last a year to a continuing resolution that lasts 3 months. Pretty soon it'll be a month, and it'll be a week. They won't be able to sell the debt. They won't be able to print enough money. We'll be like Weimar Germany from the 1920s, where all they did was print the Deutschmark to pay back the reparations for World War I. And in the meantime, send their country into hyperinflation. We'll be worse than Zimbabwe. Well, we're already worse than Zimbabwe because Zimbabwe is minting gold coins and reclaiming their currency. The straws on the camel's back are getting plentiful, and I'm not sure which one is the last straw, but we're not that far away.
So what do you see happening this summer?
Given that gas prices are winkling their way up towards 350,
Yeah.
well, I think we have been since the middle of 2021. I think we've been in recession. When I listen to Martin Armstrong, he says that where our GDP, our gross domestic product, our real GDP, which is our gross domestic product without inflation in it, and so maybe caveat that with the government is already monkeying with the numbers, but the White House says that our gross domestic product growth is about 1%, and Martin Armstrong says that's not true. It's -7% or worse, which means we're already in a depression. Well, and how surprising then that you've run down through that list of several dozen different types of businesses that are closing stores, mostly in blue states, not so much in red states. So it's not a big surprise to me that we're already in a recession. We're already in a depression, and we're seeing the evidence of it, and people don't want to see it. I mean, right now, if your audience will go over to the usdebtclock.org, you'll notice that there are over 100 million people that are not in the labor force. Well, that's fully 1/3 of our entire population. And when they say not in the labor force, they're talking about everyone over the age of 16. So we're not even counting the kids. And so what that means is there's a workforce of about 161 million. Now, that 161 million, remember, there's 30 million of those people that are damaged so badly by the jabs that they're on disability or they're not working full time because they can't. So if you take that into account, there's about 130 million people working full time that are supporting the other 200 million people in our country. So if for every one worker, there's 2 people not working. How do you make that work?
You don't. Just like in California now, where the minimum wage is officially $20 per hour. And as soon as that went into law, just in the blink of an eye, California businesses started to lay off their staff members because they can't pay them less legally, and they can't pay them more.
Correct. And that there will be a number of businesses that just shut the door and go away. They'll go to Oregon or Nevada or anywhere else but California. Or the businesses that do stay in business will hire Flippy the hamburger machine.
Old Flippy.
I'm not kidding. There's a Flippy the hamburger machine.
Yep.
I'm serious.
That's true.
Oh my God, I wish I wasn't.
Yeah, watch out for Flippy.
That's right. So I mean, we are already in a depression, and any of my students will sit in my class and they look out there and they say, "We're obviously being lied to." My students know this. They know we're being lied to. Every number that the government produces is bogus. I was on the Quite Frankly show some time back where Frank was asking me, how is it that the Bureau of Labor Statistics says that we've got such a fabulous job environment, and yet every business I pass is looking for help? And I looked at him and I said something rather flippant. I said something like, they're lying. They're just lying about the numbers. The Bureau of Labor Statistics, if you go and you look at their monthly productions of their publications, every single month in the past, they have revised down their numbers of unemployed people by the hundreds of thousands. By the hundreds of thousands. So we're coming up on the next one. It'll be the first Friday in April. I'll be entertained to see what the Bureau of Labor Statistics tells us, what bunch of hokum they come up with this month for March. But they will have revised down February, January, December, all the way back. They'll revise it all down.
Because I've seen that.
Because their numbers are fake.
Yep. Exactly. They do it every month. They'll say, well, last month's, employment numbers were better than expected. And then a month passes, and the very next month they go, oh, yeah, last month's numbers weren't as good as we thought.
Right. But then every month after that, say we're looking at March. In April, they'll say March's numbers were really good, but February's weren't quite so bad. I mean, the February's were not as good as we thought. Then we'll get to May, and they'll say, actually, February's numbers were pretty bad. And we'll get to June, and they'll say, actually, February's numbers were horrible.
Yeah.
So, every month, February's numbers are reduced even more, but nobody's looking at it. Nobody's looking at it. It's about as fake as you can get. We're literally living in a time, Sean, when you and I are sitting looking at a reality that most people don't even see. Most people are living in a totally different reality. Let me give you an example. I have a friend that I've a colleague who's up in Connecticut, and she's a professor. She's a labor professor like myself, and she thinks the economy is fabulous.
Oh my God!
She says she says, well, Biden has done a wonderful job on the economy. I mean, look, the stock market is at all-time highs. And I'm thinking to myself, my God, woman, aren't you looking at the data? Don't you go back into the previous months from the Bureau of Labor Statistics and see how they are revising all of their numbers downward? Don't you see that every number that the government puts out is a lie? We're not growing at 1%. We're sinking at 10%. Biden is not doing fabulous in his re-election campaign. He's barely keeping his nose above the water. And she can't see it. Sean, she just cannot see it.
Not to mention the stock market is just manipulated by man. It's just a dude behind a keyboard.
It's worse than that, because most of the stock market prices are manipulated by programs, buy and sell programs. There's no humans there. It's completely manipulated. It's not a free market. It probably hasn't been a free market since they put the quant machines in the 90s. I mean, it's not like on the movie Trading Places where the two main characters go down into the pit to bid on orange juice. It's not like that. There's nobody there. There's no people there. It's all run by computers and computer programs, and you can do anything with those. But this PhD economist that lives in Connecticut can't understand why every time she walks through her little town that there's businesses that have help wanted signs when the economy is just doing so great. She lives in a totally different reality than I do. And everything is Donald Trump's fault. Everything. She's got Trump derangement syndrome so bad she can't see straight. And it's obvious to her that Putin invaded Ukraine because it's Donald Trump's fault. And her home country of Poland is gearing up for World War III because it's Donald Trump's fault.
There's your next Biden voter.
Oh yeah. Well, we talked about that. She admitted she doesn't think she can vote for Biden.
Oh, really?
No. Yeah. She actually said, I can't bring myself to vote for Biden. And I said, well, what about Kamala Harris? And she goes, that woman's an idiot. I can't vote for her either.
Okay.
So at least on one teeny tiny little side path on the reality between our two worlds, she's admitting Biden's a disaster and Kamala's unvotable. And I said to her, I said, well, we can't vote for Kamala anyway because she's not qualified to run for president. Oh, yes, she is. She was born in the United States. I said, no, her parents were not U.S. citizens, neither one of them. So she's not qualified. She can't run. My students are far more aware of what's going on than their professors are. They're far more aware of what's going on. I mean, you've seen them, Sean. You've been around them. They live in an ivory tower. It never touches reality.
Yeah.
They don't understand, or maybe they don't want to understand, because if they actually really took a look at things, they would have to admit that they themselves bear some responsibility for where they're at in their life. And who wants to do that? Who wants to admit that all their decisions have brought them to where they're at? They'd rather just keep eating their chips and drinking their beer and then being upset that the scales are telling them they're gaining 5 pounds every other week. So what do I see? It's a disaster and it's coming at us. I think that by the time we get to June, it will be perfectly clear, even to the most sacked out sheep, that we're in big trouble economically. You heard about that bridge in Baltimore that got hit by a container ship this morning, right?
Yep.
Yeah. So that means none of the container ships that are in port in Baltimore are getting out anytime soon. And there's no container ship sitting outside the port that's going to be able to unload there. How many more bridges around our port system are going to get hit by container ships that actually lock down our port system?
Or airplanes that go down remotely because all the electronics get turned off from some apparatus someplace and then no one wants to fly.
Right. You know, how many more incidences like this is it going to take for the White House to just say, well, look, you know what? We just need to postpone the election for a few months just till we get back on our feet.
Yep. That's an excellent...
You know, in order to save democracy, we've got to kill it.
See, that's one of, if I'm not mistaken, that's one of Yuri Bezmenov's points, was that you have to bring things into complete and utter chaos, at least from a visual standpoint to the unknowing person, because then that's when you roll in your one world government. And the one world government openly says, we're here to save you. Just in time, by the way, for the old pandemic treaty also.
That's right. Oh, yeah. These politicians have been bought and sold so many times that it'll make your head spin. I mean, if they were to wear jackets with all the people who support them, they'd look like a NASCAR driver. And then at least we would know who's been, buying and selling them. So, yeah, that's the whole part of the communist plan, right? Destroy the government, destroy the family, destroy the communities, and then the one world government can just waltz right in and say, here we are to save the day. Except that, one little wrinkle, people are waking up. People are waking up faster now than they were 2 and 3 years ago. When we were sitting in the middle of the pandemic, how many people did you know, Sean, that actually could cognize what was going on?
Very few.
And how many are today? More.
Yeah, it's certainly more.
There are more people. So that's the wrinkle in the New World Order's plan. The wrinkle is that the more they do, the more they push, the faster they push, the more people wake up, and then the next thing you know, you've got the majority of people in the United States rubbing the sleep out of their eyes, looking around going, what the hell is this? Oh, no, we're not doing this.
Yep.
So I'm really hoping it doesn't come down to an actual physical fight. I think maybe that it won't, but I don't see the 7th Cavalry riding over the hill to save us either. I think we're going to have to save ourselves. And I've been saying this since like the spring of 2021. When the military did not step in on January the 20th, 2021 to keep that potato from giving his quote-unquote oath of office, that's when I figured out, oh, there's nobody coming to save us. We got to do this ourselves. We got to figure out how this whole system works really fast so that we can take it back. We have to figure out as individually so that we can spread it around into our communities. We have to figure out, where did we go wrong? What piece did we miss in this whole puzzle? And I think the piece that we missed was that somewhere along the line, our sovereignty was stolen from us. Because when our founding fathers rolled together, when they wrote the Declaration of Independence and the U.S. Constitution, it was with the thought in mind that each and every man and woman and child in America was a sovereign individual that owed allegiance to no man and no government. They owed allegiance only to God. And that particular piece was stolen from us. As opposed to a person who is a U.S. citizen that owes his allegiance to the government. How many times were we in school where we were saying the Pledge of Allegiance to the flag?
Every day.
Yeah. And so some of the research that I've been doing has been diving down into where did we take a wrong turn? Where were we? What time period was it where the wool was pulled over our eyes? Where it was learned out of us that instead of being a sovereign individual, that we should be instead a proud U.S. citizen. And you have to go way back. I mean, you got to go way back into the 1800s. Some of the research that I've been doing is around allodial titles of property. And an allodial title is where you own that property, the land, the buildings, anything that is immovable. You own it outright, and there is no superior landlord. There's not one. There's no one that owns property today that does not have a superior landlord. And the reason I know that is if you don't pay your property taxes, who takes the property? The government.
Yep.
And so back in the 1800s and in even the late 1700s, property was sold with an allodial title. An allodial title meaning that you and your heirs and anyone you assign owns that property in perpetuity without having a superior landlord. And only a sovereign individual could own allodial title. Because you have to be the sovereign.
I heard you on Jesse James bring this up, and it's beyond fascinating. And you're right, this is where things took a turn for the worse, and where people started to just trust government, and when government said, well, this is the way that it's going to be, there were always the dissident voices who said, no, this can't be. But then, of course, they just ram it home anyway. And then
Right.
everybody has to go along, or else you either get arrested or you end up paying heavier fines that you can't pay, or you lose everything that you thought you had.
Right. Yeah. I mean, we don't even own our cars.
Correct.
Even if you pay your car off, you still don't have the manufacturer's, what is that? Manufacturer's certificate of ownership.
Yep.
In Ohio, it's the state that holds the MCO to your car. So you go to the dealer, you buy a car, you sign all the paperwork, and then you give your car to the state by sending them the title. Because nobody tells you that you could hold the MCO yourself. Nobody tells you that. But you don't have that right as a citizen because you owe allegiance to the government as a citizen. You know better than a servant. So, that's why Klaus Schwab can say you'll own nothing and be happy, because you essentially own nothing. And if you pay with fiat money, that's just a debt instrument. It's not actually money. You don't even own your money unless you pay for your car in silver or gold. There's some movement out in the country where people they're re-educating themselves as to where we went wrong in the United States and how this wool was pulled over our eyes and when it was pulled over our eyes. And when you sit and realize that because your mother signed your birth certificate as an informant, she literally gave you to the government. But your mother wasn't informed that that's what she was doing. So that is a fraud and swindle. From the day you were born until the day that birth certificate was signed, you were a sovereign individual, owing allegiance to no one but God. And so we've been lied to. And what that means is everything that we look at has been a fraud. And fraud vitiates all contracts. Fraud makes all contracts null and void. And so once you learn, once you have educated yourself to how you were frauded and swindled out of your birthright, then you can go reclaim it. And that's the point where we need to get people to realize they have been defrauded, they have been lied to. All of the contracts everywhere are unlawful. That's where we need to get the American people. That's the direction we need to take them. They need to start doing their own research. They need to figure out where and when and by whom they were swindled. And that's when we can take our country back. And that's when we can kick these globalist scum to the curb. Because they did it. All of this Luciferian satanic stuff. Who's the father of all lies? Remind me again.
Yeah. Yep, Satan himself. Yep.
Not too surprising that he's got all his minions infiltrating every company, corporation, institution, and government at all levels. I think Cliff High is right. I think that at some point, while it might take years to clean out a lot of this crap, I think a lot of this crap is already getting cleaned out. But at some point, you need the people to wake up and realize the crap that's around them so they can do their part too. Yep. You do your part. You've got your podcast. You've been very vocal up in Oxford, Michigan. I've been very vocal to my students. Even next week, I'm giving a presentation on allodial titles and land patents, and it's really nascent research, as far as I can tell. Nobody's been looking into this for at least 100 years. But you go back 100 years and people knew that their grandfathers or their fathers had purchased their property with an allodial title and a land patent, and they didn't have to pay the government taxes to keep it because they owned it outright. Birth certificates are a relatively new thing in the United States. They didn't actually start cropping up until after the 1920s. And so up until, in fact, there was a little tiny, there was an act that I think it was Coolidge pushed through Congress to have every baby have a birth certificate, and that kind of fell flat. So it wasn't until the 1930s, after the Social Security Act was passed, that people had to have a birth certificate in order to get their Social Security. Because when my dad was born, he had no birth certificate. He remembers when he got one, because he got one as an adult in order to eventually get his Social Security. So he gave up his sovereignty willingly because nobody told him. Look, as a sovereign individual, you have the unalienable rights that God gave you because you exist. But if you sign over your life and become a U.S. citizen, you owe your allegiance to the government. It means you are the government's slave. The government owns you. And so this was all part and parcel of what happened in 1913 with the Federal Reserve Act.
Yeah.
This has been a long, slow process. So when Yuri Bezmenov says it takes 2 or 3 generations to demoralize a population, it takes even longer than that to infiltrate a country so completely that nobody remembers why we actually fought the American Revolution. We fought the American Revolution not because some tea got a little bit more expensive. We fought the American Revolution because we were trying to tell old King George, each of us, are a sovereign individual. We stand on equal footing with you, King of England. And that's why George hit the roof when he got the Declaration of Independence, because it meant that these upstart colonists thought they were just as good as him, the King of England. And where there were a whole bunch of colonists in America saying, well, we are. We are equal in the eyes of God. So they've been learned out of it.
And they're not going to learn it in school. And they're not going to learn it at the university level, of course, unless they have your class.
Well, my students are learning it. Yep. And let me tell you, a lot of them are pretty shocked. But it's through programs like yours and programs like Jesse's where the word can start to get out and people can start digging into the old documents to find out, well, what did happen? You know, I know where we went wrong because I've been doing the research. But until you go and you figure it out for yourself, and then you can get really mad because you've not only have you been lied to, but your parents and your grandparents and your great-grandparents have been lied to. And it's all a big fraud and swindle. And when you figure out it's been a fraud and swindle, then you can take some steps and change, make sure that you let the government know, no, I am a sovereign individual. You lied to me. I decline to be a U.S. citizen. That's just being a slave. I'm no one's slave. So thank you for letting me speak about this, because that was heavy on my heart to let your audience know they have been lied to their whole entire lives. And it's time to start taking our country back the right way. Not necessarily through guns, but it is through individual action. Reclaim your sovereignty. Then tell the government to go to hell.
Thank you for listening to American Education FM. Make sure and check out AmericanEducationFM.com for more information. Take care and God bless.